Hello, I am Dr. David Brinker, Medical Director of the Blood Bank here at St. Joseph Medical Center. Today, Yvette Hammond, our blood bank supervisor, and I will give you a few tips on safety in blood transfusions. More detailed information can be found at the blood transfusion guideline available on the hospital intranet under hospital-wide policies. Just search for the word blood to find it. Simplified steps are summarized on an information card released along with the blood from the blood bank. Blood transfusion can be life-saving, but also carries risks. Our most important job is preventing a potentially fatal reaction from the transfusion of ABO-incompatible blood. A number of other, generally less severe reactions are also possible. The nurse's role in prevention, recognition, and treatment in cases of transfusion reaction is critical and potentially life-saving. It is required practice to have positive patient identification before transfusion begins. It used to be that two nurses would verify the blood and the patient prior to transfusion. Now, with our computer system, scanning the patient in Cerner takes the place of the second nurse. So it's very important that when setting up the transfusion, you scan the blood in Cerner prior to scanning in Epic.
Most of the time, transfusion takes place without a reaction. There are several types of reactions, and they share many signs and symptoms, including fever, rash, and dyspnea. The reason that you stay with the patient for the first 15 minutes of a transfusion is to watch closely for a reaction. If you think there might be a reaction, stop the transfusion, but keep the line open. Notify the patient's physician and the blood bank. The blood bank may ask for a new sample to be drawn to check for hemolysis. The only type of reaction where you could restart the transfusion is an allergic reaction, basically hives. If the physician orders diphenhydramine and the patient's rash goes away, the transfusion may be resumed. All other types of reaction require the blood to be sent back to the blood bank for checking. One type of reaction that is relatively common is a febrile reaction, defined as an increase in body temperature of at least 1 degree Celsius during transfusion. To help prevent this reaction, pre-medication with Tylenol is often given before transfusion.
While we're talking about reactions, it would be good to review the basics of ABO typing, since an ABO-incompatible blood transfusion must be avoided 100% of the time. There are 4 main blood groups based on presence or absence of 2 red cell antigens, A and B. There is no O antigen. You can think of the O like 0, because neither A nor B antigen is present. Group A people have naturally occurring strong anti-B antibodies in their plasma, and Group B people have anti-A. Group O individuals have antibodies to both the A and the B antigens. Group AB are the opposite of O. They have both antigens on their red cells and neither antibody in their plasma. About 40% of our patients are Group O. These people are called universal donors, since their red cells can be transfused to anyone, regardless of ABO type. Group A people are another 40%, and Group B is about 15% of our patients. The remaining 5% is Group AB. They are called universal recipients, since they can receive any ABO type red cells. Our blood suppliers provide us with all 4 types of red cells.
The interaction between A and anti-A or B and anti-B can set off intravascular hemolysis, coagulation, and shock. We must be careful to verify the ABO type of the recipient when any red cells other than Group O are transfused to avoid a potentially deadly reaction. So sometimes the blood bank will need a second independently drawn sample to double check the ABO type. This is not all the time. We don't need a second sample if the patient is Group O or has a previous blood type in our computer system. In an urgent situation, when a patient needs red cells right away and there isn't time to draw a second sample, the blood bank can issue Group O red cells. Remember that anyone can receive Group O red cells safely. Once the patient is more stable, the second specimen can be drawn and sent to confirm the ABO type. That way, we can start giving type-specific blood and conserve our Group O units.
Again, to emphasize the point we made earlier, staying with the patient during the first 15 minutes of a transfusion is crucial in recognizing a potentially serious transfusion reaction and stopping the blood. Vital signs are taken at intervals throughout the transfusion. Please relay any significant change in the vital signs to the patient's physician. A few words on temperature and blood. Red cells need to stay cool and so are stored in a refrigerator. Platelets, however, will deteriorate if cooled, so are kept at room temperature. For all products, transfusion must begin within 30 minutes of leaving the blood bank and must be completed within 4 hours. Thank you for your help in keeping our patients safe during blood transfusions. The important points we would like to mention again are:
scan blood in Cerner first for positive patient identification, then in Epic prior to starting transfusion. Stay with the patient during the first 15 minutes of transfusion and watch closely for any signs of a reaction. Notify the physician and the blood bank if you suspect a transfusion reaction. The blood bank staff are on duty 24/7 at extension 1713. Call us with any questions. Thank you.